Okay. Okay, unfortunately we had a little problem with the streaming, so we didn't see the start of it. This is a dog that had a low-grade mast cell tumour excised roughly 2 years ago, and has a reoccurrence in the surgical field. So suspect it's a reoccurrence rather than a new mast cell tumour. The initial one was completely excised with good margins and it was low grade, so the risk of reoccurrence is 3% or less, so pretty unfortunate. This dog had a lot of scarring. The wound dehisced last time and had a lot of scarring, so we don't have that much mobility in the skin around this tumour. So the owner decided to go ahead with marginal resection and electrochemotherapy. So we're just doing the marginal resection now. And then we'll do the electrochemotherapy. If we can get the electrochemotherapy machine working. Just hold that back like that. You can get closer there. We did also offer the possibility of a flap, but the owner declined.
Would you do caudal superficial epigastric or genicular?
Or my favourite is the inguinal flank fold.
Okay.
I don't know whether the caudal superficial would get down that low. Take that quadriceps fascia as the deep layer. Okay. Do you want to call Shanna in?
No, she's on a case.
As in, well, we need to get Krista in to give the chemo and stuff. We need to call Krista in to give the chemo as well.
Okay, yeah, okay. Shanna's is on a case, but just let her know.
So that'll close up primarily quite nicely, but I want to use the electrochemotherapy. I was thinking overnight how to do this, as in do I close and then do electrochemotherapy, or do I treat the base and the margins separately, intraoperatively?
Right.
Kind of figured that might be better.
Yeah.
So just like
There was an encoding error or something.
so it's not. Overwhelmed with errors. There's an encoding error. It says do something. You in technology, Sarah?
It's not technology, it's this specific. It doesn't like the way that I'm putting in the patient info. And then it makes me start all over again. So yeah, sometimes we are really like a little bit of what I call like overgrip. So I would take that out.
Really cool.
What's that?
I
We need to give the chemo.
Now?
Yeah.
I thought you already excised this. I see.
Yeah.
Okay. Okay. Didn't she say she needed to flip the dog and place an IV? That's what Melissa
She didn't do it
said.
already?
No, she wanted to do it right before doing chemo. Because we thought we were excising this, closing it, moving to special procedures. That's what Krista said.
Okay, there's a miscommunication as in I want to treat the bed and the margins
I see that.
while it's open, and I thought that she was putting the catheter in before we came in.
They can place a catheter under the drape, but I don't know about flipping the dog. Obviously, that's not going to happen.
Look it, I got it. I don't know what to do now.
Why do we need to use a new catheter?
I don't know. They like their own. That's them.
Okay.
That's a them question.
Okay. When they come in, I'll ask, because if we've got clean catheters up front,
Is it clean? We had a lot of struggle with this catheter. Was that poke okay?
Yeah, it was the one quick poke.
That one was good. So it is.
so I don't know why we can't just use that. And if it's a matter of authorization and taking responsibility, then I can take that responsibility.
Sarah, is this
Kiss theory.
good now?
I entered the patient info.
Okay.
I don't know what else is supposed to do.
Krista is not available for the next 20 minutes.
Oh my fucking God.
She's 30 minutes.
Okay. Oh, so, excuse me. Excuse my language. Okay, so we've run into a bit of a snag here in that our medical oncologist usually administers the bleomycin, and she's just gone into a consult. So maybe, can I give it? Yeah, thanks.
I think we have to keep going and hit right nose. Because it won't let you do the treatment. What's the dog's weight?
We are 36.6 kilos.
What's your estimated height at Withers?
Estimated height at Withers.
In centimeters.
50 centimetres?
Okay, tumor sign.
Krista said no.
Why not?
Or it's all I got. What's that? No.
Is she in a consult right now?
She's with a sedated dog, but no, she's not.
Oh. So we're just running into a few little difficulties here. We've got the electrocorrelation ready to go. Medical oncologist, unfortunately, is delayed, so we will just have to wait until she comes in to give the bleomycin. The bleomycin is a poorly absorbed chemotherapy agent, which means it doesn't make the dog sick or anything else like that. We give the bleomycin, and then 7 minutes later we do the electrocorrelation. And essentially, in layman's terms, the electrical current will then open up the cells in the area that's the current's applied. And when those cell membranes are open, the bleomycin basically pours into those cells and kills off those cells. So it's a form of local treatment for mast cell tumours. It does significantly reduce the risk of local reoccurrence. Matteo wanted to be quizzed. What's the local reoccurrence rate for grade 2, incompletely excised grade 2 mast cell tumours? I'm not going to be hard on you if you don't know it, by the way.
Is it less than 15%?
It's 17 to 30%. So this reduces the electrochemotherapy reduces the reoccurrence rate down to below 10%. Radiation does it to 7%. So it's an effective technique, and hopefully it'll work for this dog. Considering we don't really want to put him through too much more. And this dog's very hyperactive as well, I should have mentioned. So that was a contributing factor to his wound dehiscence to begin with. So we actually have him on trazodone for 10 days after surgery just because of his hyperactivity level. So now it's just a matter of waiting. And we may have a discussion over catheters.
Sorry?
We may have a discussion over catheters.
So, like, when you inject it, do you just inject it into the tumor, or do you, like, tourniquet and go intravenously? Or
The
how do you
bleomycin,
bleomycin?
just intravenous.
Okay.
Yeah, so you can do it intratumoral. That's more often with cisplatin. But because cisplatin is cytotoxic and if it's in if you have a tumor itself, or even if you do it around the resection site, the chance for leakage and safety of our staff is an issue. So we don't tend to do intratumoral for that reason.
Okay. And what about local, like with the tourniquet, like intravenously by the tumor, like if you had
Doesn't matter, because the chemotherapy drug's so poorly absorbed. It'll, yeah. So what I'll do, Matteo. Oh, great. Great. Here is Krista. You're on live feed, just by the way.
Hello. Good morning. We just need the right hind limb to place a catheter.
Okay. We've got a good catheter up front.
We need a new catheter.
Why is that?
We always place chemo in a fresh new catheter and poked vein.
Okay, if this doesn't work, then we're using that, just so you know.
Okay.
Okay.
Sure. I think, did you get my text?
I got a text. You just said you needed a new vein.
I said that the only option was the left hind leg.
Yeah, I thought you were going to put the catheter in before I got in here.
Oh, we can't do that, no. For chemo, we always place it right before, just so that we know it doesn't move.
Okay.
Make sure it's safe.
So, as I said, we've got a nice catheter up there that's working with a clean poke and everything else. But
For my
here's...
understanding, the wound's been poked.
This side was one poke and right in, yeah.
Yeah.
Do you want me to flush it?
Well, we'll still place a catheter here,
Okay.
because we always like to place it right before, just in case anything moved or changed.
So we're just going to
We like to
protect
really
this.
step away from chemotherapy.
Oops, what happened there?
All right. Do you need a table or something? No? Okay. All right. Tell me what to do.
Is it doing an update? Okay. So our oncology team is just going to place a catheter and give the bleomycin. So Materne Etienne, I'm going to, I'll use sterile hands to apply the, so I'll hold on to the unit, but basically I'm going to be like the needles are sterile, and I'll just hold on to the unit, but then I'm kind of scrubbed out, so I'll just get you to close afterwards. Yeah.
I'm very excited to see. Only learned about this this week.
It's not that exciting. It's good to see, but yeah, they jump a little bit.
So this is our chemotherapy we're just going to put on his hand. And then you can use it for your supplies.
And let me know if I can do anything here.
Yeah, that looks pretty good like that. And then when we're ready to give the chemotherapy, we'll give everyone just a step out and we'll give it and then
Okay.
step out. As long as it's safe to do so.
We're doing all dog and nice.
Yeah, good.
Okay.
Perfect. That's awesome.
Let me know if I can do anything on this end.
Is that good?
You can stop holding.
So we have a clean poke, so they're just securing the IV catheter